Come to order. Today, we are meeting to discuss and vote on the Prepare for, Respond to Existing Viruses, Emerging New Threats, and Pandemics Act, or the Prevent Pandemics Act. We will adopt the Manager's Amendment in the nature of a substitute, which will be the base text for the amendments committee members will offer, debate, and vote on today. While we were, again, unable to have the executive session fully open to the public or media for in-person attendance, live video with closed captioning is available on our committee website at help.senate.gov. If you are in need of accommodations, again, you can reach out to the committee or the Office of Congressional Accessibility Services. 2 years after the COVID pandemic was first declared a public health emergency, we are in a better position today than ever before to move past this crisis. Vaccination rates are up across the country. Over 81% of those eligible are vaccinated with 1 dose, and nearly 70% are fully vaccinated. Case rates are down. Schools are open, with nearly 100% of schools safely back to in-person learning, and people are getting back to their lives. But we all know how long of a road it has been to get here, how many loved ones we have lost along the way, and how much damage a crisis like this can do if we are not ready. We all know how important it is we maintain the progress we've made and never go through this again. I will always remember when the first case in the United States was identified in my home state of Washington 2 years ago, and the frustration of pressing for answers to questions families were desperately asking. Where can I get a test? Why aren't they easier to find? Why are the results taking so long and not getting those answers? And those were just the first of many questions I heard from families throughout this pandemic, questions we frankly should have never had to ask in the first place. Time after time, we have seen how our response could have and should have been better. After all we've been through to get to where we are today, we owe it to everyone who has worked so hard to address the challenges of this pandemic to make sure we not only prepare in the immediate term for the next phase of this pandemic, which I'll get to, but that when the next public health crisis comes around, we are never in a situation like this again, which is why Senator Burr and I decided to work together on a bipartisan legislation to strengthen our public health and medical preparedness and response systems. And I'm pleased to say that after nearly a year of working with our colleagues on this, the Prevent Pandemics Act includes ideas from over 37 different bills and 33 different members on both sides of the aisle. These are bipartisan steps to strengthen our public health system by learning from what worked and what did not in our COVID response. For example, during this pandemic, access to medical products such as life-saving drugs, ventilators, testing components, and personal protective equipment like N95 masks has been a constant challenge. So among other steps, the Prevent Pandemics Act strengthens the medical supply chain, supports domestic manufacturing, improves management of the strategic national stockpile, provides more transparency to identify potential shortages, and strengthens FDA's enforcement authority against counterfeit medical devices like fake N95 masks. I want to thank Senators Hassan, Baldwin, Murphy, Casey, Peters, Cardin, Cassidy, Durbin, Romney, Collins, and Braun for their work on some of those proposals. The bill also helps get safe, effective medical products like tests and masks to families faster, with steps like simplifying the application review process for technologies that can be adapted to different needs, and improving access to the samples of specimens needed to develop diagnostic tests, which Senator Kaine and Senator Braun have worked on. Another lesson to take to heart from this pandemic is how years of biomedical research and sustained investments that started way before most of us knew the word coronavirus led to the development of safe, effective vaccines in record time, which is why I'm glad I was able to work with Senator Burr in this bill to support cutting-edge advanced biomedical research by establishing the Advanced Research Projects Authority for Health, or ARPA-H, as first proposed by President Biden last year. And the Prevent Pandemics Act also supports developing treatments and devices that may be needed in public health emergencies and antivirals for pathogens with pandemic potential, implementing best practices and strategies when preparing for and responding to emergencies, addressing antimicrobial resistance through increased laboratory capacity, coordination regarding the blood supply, and research on long COVID, which so many people are still struggling with, thanks to the efforts of Senator Brown, Casey, Hickenlooper, Rosen, Lujan, Murphy, Gillibrand, Smith, Collins, Rubio, and Marshall. Another challenge throughout this pandemic has been outdated and incompatible data systems and incomplete demographic data, which left public health experts without the information they needed to make critical decisions. That's why our legislation directs CDC to develop public health data standards and work with public health departments to develop best practices for improving data availability, quality, and completeness. It also strengthens our ability to use data to identify viruses and new variants and predict and prevent disease outbreaks. I want to thank Senators Kaine, Braun, Baldwin, and Romney for their work to improve our public health data systems. One of the early shocks I had personally during this pandemic was getting a text very early on that my grandkids' school was closing. And since then, I have been thinking about and hearing from parents with kids who are just not okay, and I've been pushing to make sure the policies coming out of Congress actually work for working families. I've seen that one of the reasons policies don't work for parents is that too often people making the policy decisions aren't the ones figuring out childcare or packing lunches. That's why I pushed in this bill to make sure the National Advisory Committee on Children and Disasters, which directly advises the Secretary of Health, must include parents, caregivers, and teachers as members. I've been working to make sure parents had their voices heard throughout this crisis, so I'm glad we were able to take these steps to ensure they're heard during future health emergencies as well. This pandemic has also stretched our public health and healthcare workforce thin and made it hard for people to get care, which is why the Prevent Pandemics Act includes policies to bolster the workforce that keeps our communities healthy through a loan repayment program for public health workers to support frontline health departments across the country, a community health worker grant program to increase access to care in underserved communities, increased educational opportunities for people seeking careers in fields like physical therapy, occupational therapy, respiratory therapy, audiology, and speech-language pathology, grants to improve trauma care, which can be especially important in our rural areas, and more. And I really want to thank Senators Casey, Smith, Reed, Booker, Rosen, Murkowski, Collins, Tillis, Thune, Reed, and Moran for their work on provisions supporting public health and healthcare workers. And when we talk about healthcare, it's important we address mental health and substance use disorders too, as this pandemic has seriously worsened our nation's existing behavioral health challenges. The stress and anxiety and trauma of this crisis have been catastrophic. We've seen a large uptick in youth mental health emergencies and a record number of drug overdose deaths. So I'm grateful to Senators Lujan, Collins, and Casey for their work in this bill to make sure our plans for public health emergencies include plans to help people access mental health and substance use disorder services too. We've also seen misinformation run amok during this pandemic to devastating effect. When people are looking for information about masks or vaccines or what they can do to stay safe, we need to make sure they can find accessible, reliable information from trusted sources. That's why the Prevent Pandemics Act establishes an advisory committee at HHS focused on effectively communicating life-saving, science-based guidance and debunking misinformation during public health emergencies. And I want to thank Senators Murphy and Lujan for their work on that issue. And then, of course, we've seen inequities in our healthcare system, making this crisis so much worse for so many people, particularly communities of color, people with disabilities, and rural communities. These communities were underrepresented in clinical trials, had less access to tests, vaccines, and other medical resources, had higher rates of infection, hospitalization, and death, and our public health data often lacked the information necessary to respond to those trends. It's important we address these issues from top to bottom, which is why this bill includes steps to develop best practices in demographic data collection, modernize clinical trials with options like remote trials that can be more accessible for underrepresented communities, ensure tribes have direct access to federal supplies of medical equipment, identify gaps in our response that left out people with disabilities, chronic illnesses, the immunocompromised, and older adults, and support state, local, and tribal health departments in addressing underlying issues related to health equity like housing, nutrition, and more. And I'm very grateful to Senators Murphy, Smith, Warren, Menendez, Casey, and Scott for working to include some of these important health equity provisions. In addition to all those meaningful steps to strengthen our public health system for future health emergencies, we all understand there is more work to do if we are to fully recognize the lessons of this pandemic, which is why this bill establishes an independent task force modeled after the 9/11 Commission to conduct a comprehensive investigation into the U.S. response to the COVID-19 pandemic and issue recommendations. I first called for this in March of 2020, and I feel very strongly about it. And I want to thank Senators Menendez, Gillibrand, Feinstein, King, Casey, Collins, Marshall, and Ernst for their leadership on this. And I'd also like to thank all of my colleagues on the committee and off who worked with Senator Byrne, me, to strengthen this legislation. And finally, I really want to say how grateful I am for all the hard work and long hours put in by both my staff and Ranking Member Burr's staff. And I'll have more to say on that later as the process continues, but I do want to take a moment to acknowledge and thank all of you who worked on this for everything you've done to get us this far. I look forward to passing this bill out of committee today and into law soon to show families across the country there is bipartisan support for making sure we learn from this pandemic. And I hope that we can work in a similarly bipartisan way to pass a COVID supplemental that shows we are committed to ensuring we have the vaccines and therapeutics and other measures to continue to have the upper hand in this fight. We've made great progress to get past COVID-19, and many people are finally starting to get back to some sense of normal. But we have to remember, a fire is dangerous down to the last ember, and absolutely no one wants to see this fire start spreading again. When this committee started hosting briefings and hearings on COVID-19, I never imagined it would become as political as it has. Everyone in this room knows those politics have made passing supplemental COVID-19 harder, and I hope all of my colleagues can continue to see this funding for what it is. The funding that is being asked for will make tests, treatments, and vaccines widely available, ensuring we are ready if new variants emerge, developing the next generation of vaccines and treatments, and supporting global vaccination efforts so we can stop this from spreading and mutating in ways that could put our country back into jeopardy. In short, it is funding that we urgently need to keep Americans safe. These are the very resources that none of us want to have our constituents do without. So I hope we can all work together to pass additional funding to stay ahead of this virus and stay ready for whatever is next and defend this hard-won progress we've made. And finally, while the Prevent Pandemics Act takes important steps to strengthen our public health and medical preparedness agencies, COVID-19 has really made clear that we need to do beyond the scope of this as well. For example, we absolutely have to follow up on critical steps to improve our public health and preparedness policies and process with a sustained annual investment in public health and with robust investments in pandemic preparedness and response, like President Biden has called for. And beyond improving our public health and preparedness system, I hope we can take action with additional steps Democrats are pushing for on other issues, like making sure people have paid leave that allows them to put their family's health first, affordable quality health care and child care, safe and healthy workplaces, including strong protections for our workers, especially those frontline workers, hospitals and nursing homes, meatpacking plants, and grocery stores. So I look forward to working with all of my colleagues on these issues. And again, I want to thank all of you for your work on this, for your input, for helping us get to where we are today. I think it's so important that as a nation, we don't go, oh, we're past this, but we think, what can we do to make sure we never go through this again? So I want to thank again all of our colleagues, all of our staff. Look forward to continuing to work with all of you to get this done. With that, I will turn it over to you.